Guys, thank you so much for being here. The foundation is really incredibly honored to have both of you here. We have Pete Delgado, who's the CEO of the healthcare system, and Carla Spencer, who is the director of the emergency room and also the chair of our board at the foundation. So thank you guys for being here.
Thank you, Jeff.
Hey,
so
when you call, Jeff, we come. I can't say much more.
Thank you. So what I wanted to do is kind of have a loose conversation and talk about some of the things that are going on amidst what we have happening here with COVID, and kind of get the impression from you two, kind of the tip of the spear of the clinical side and the business end of the healthcare system and how we're adapting to things. So Pete, maybe I start with you and just ask how the healthcare system itself is kind of adapting and moving to the current climate with COVID, and how you are still keeping the healthcare system, effective to providing wellness and care for the patients in the community.
Well, thanks for the question, Jeff. Our jobs as leaders is twofold. One is to remind our nurses, our ancillary services that we've got this. We've trained for this. We've been prepared for this. We've been dealing with viruses, infection control measures throughout our careers. And when these kinds of pandemic, it calls for just stepping up a bit more. But we just got to remind everyone that just practice what you know. We've done all the training, and we're going to give you all the tools to manage our patients in a safe way. And then, secondly, we've got to make sure that our employees are well informed. The more informed they are with what's going on and about this sneaky, nasty virus that we've got to deal with, the better prepared they can be, and more comfortable they feel showing up to work, knowing that we're doing everything possible to keep everybody safe.
Right. Thank you very much. And Carla, you being kind of on the front lines here, and especially all of your coworkers, the staff in the emergency room and in the walls of the hospital that are taking care of these folks and are having those challenges. How's everybody doing, and how's the healthcare system really been engaged in fighting this thing?
Well, Jeff, I've been with the healthcare system for 18 years now, and I was proud to work here, and I'm even more proud to work here now. It's something that we never thought we would see in our lifetime, and, it came. And what happened was, instead of people just saying, oh, I'm just going to keep doing what I'm going to do, it wasn't like that at all. Everybody said, you know what, we're going to beat this. How can we do it? And let's get engaged. And I'll tell you, we became closer than ever. We protect each other, and we're a family here, and everybody, it was a unified effort on the part of the ER team, our leadership, and our providers, everybody in the hospital on the inpatient side. I mean, it was a unified effort, and everybody got together. We developed such amazing processes, and the staff, like Pete said, they're informed. They're engaged in making decisions at the front line. And what that gives you is a happy staff that come to work and they feel confident that they could care for these patients in a safe manner while keeping themselves safe. And I think that overall has been the best thing from my point of view as a leader, is that I'm just proud to lead this team. And we've done such an amazing job getting all of our processes in line. I mean, I've been contacted by several Bay Area hospitals to wanting to know what we did here, because the word is out that we are the most well-prepared hospital in our area. So it's really comforting to know that.
Well, it's been impressive to watch, Carla. Thank you for everything that your group is doing, for sure.
Thank you.
So that's a good segue. So the community has really stepped up here. They've really reached out. There's been a lot of in-kind donations and financial support for the response to COVID. With regard to how the community has engaged the healthcare system and a lot of things that have passed through to help with the staff and to thank them for things, how's the staff received that? And and what are their views on how the community's really reached out and are championing the efforts that they're making?
Well, I could say, on the part of the ER, we have had such an outpouring of love from so many different companies, and we've had meals, and we've had, bags with, comforting items in them, and lotions and hand sanitizer, and, you name it, we have gotten it in the ER. And, one day I could remember I was in the ER and we heard all of these beeping horns, and we were like, what's that? We thought somebody was driving up to the ambulance bay. And when we walked outside, it was a brigade from Bridge Hospice Care, and they had signs and they were beeping their horns and saying thank you, and they drove in the ER and in the ambulance bay, and it was the most touching thing, and we all kind of ran outside to see what was going on. But we have never felt so much love. We've gotten so many signs and cards from kids, and we have them posted near our COVID tent, and the staff love it. They walk by it every day, and we really are so grateful for our community. They've shown us nothing but love, and we've received so many different donations, and so it's really rewarding to watch.
Well, it seems like they really are passionate about thanking everyone for the hard work that they're putting in. I mean, I think the community really realizes that these people are really moving above and beyond to make sure that the community is safe while we're dealing with this. So thank you to your staff, absolutely, for everything that they're doing.
Thank you.
Pete, with all of the generosity that's happening and all of them, I mean, I realize things are coming at you at a velocity that are incredibly intense, with trying to figure out what kind of this new vehicle is going to be, how healthcare is going to be applied safely, and everything's going on. We've had a lot of generosity. We have a lot of very generous donors that support us throughout the year. How has that really made a difference in your ability to kind of flex and move with what's happening and continue to provide those good services?
Well, it has helped us to this point to have us prepared to respond to something like this. The work that the foundation did to expanding the access by helping us bring the access to Gonzales, building a Taylor Farm clinic there, making it. It's a nice gift to the community, but making access a little bit easier for everyone in South County. The volunteers and the support for the Blue Zone, so we can all work together to close the community health gap. The contributions from everyone regarding the mobile van. All of these investments has positioned us very well to respond appropriately for these kinds of events, pandemic events. Hopefully we don't have nothing like this in the near future, but it really has been gratifying to hear all the good comments, but also be reminded of how well we're positioned to respond because of the help of the community.
Well, I think you're absolutely right. And I think, again, as much as we've talked about the history of the hospital and this community and how it came to be in the first place, was the community rising up, recognizing a need and stepping up to fill it. So yeah, absolutely. Thank you. So Carla, as far as, you are really, again, just kind of where the rubber meets the road as far as care delivery. Looking forward through this, what kind of needs are you identifying, and how can the community continue to wrap their arms around the healthcare providers and support them in their mission?
Yeah, and like Pete said, it's a very kind of sneaky virus, and so there's so many unknowns out there. And what we've been doing since the beginning is we're planning for the worst and hoping for the best, right? And so I think as time goes on, we have to kind of wait and see what happens. You know, what happens when they start loosening shelter-in-place restrictions. You know, are we going to, you know, get surge of patients? I think there's some unknowns. Personal protective equipment, while we have a great supply, you know, we don't know what that's going to, you know, what's going to happen as we go on. So I would think that it's just kind of one of those things. I mean, we're getting a lot of support from the community, from our administrative executive team. And, you know, it's just something I think we have to continue to watch and be cognizant about, and, you know, watch our supply chain. So, you know, things like that.
Yeah. No,
I think if I could add to it, you know, we've done a lot of work in the past and currently to earn the trust of our community. And so it feels good that when we say, look, we're sorry, but the visitations, we can't do visitations right now to keep our patients and our staff safe, but also us reinforcing the importance of social distancing and home shelter and taking our advice to heart, because they trust us. And that's reassuring, Jeff, that the people are beginning to not only hear us and trust what we say, but open their arms as well.
Right, because their healthcare definitely can't wait. That's
Right.
a great message.
Yeah.
Well, I want to extend the opportunity to either of you, if you have something you'd like to add. Carla, do you have any kind of closing comments here as we wrap this up?
Oh, I think, you know, just a lot of gratitude on the part of the healthcare system, and speaking for our teams here, and our, you know, gratitude to our community for everything that they've done for us, and just a assurance to them that, you know, we have amazing processes in place, that we are ready for anyone that walks through the door, COVID or not, and that, you know, we're here for you. We're here to care for you. And, you know, don't delay if you're sick and you need to come. And that's it. And I'm always available to answer questions.
Oh, thank you so much. Pete, you got anything you'd like to add?
Well, Carla said it all. I mean, we really appreciate all the work that our staff's been doing to keep everybody safe in-house and in the hospital and outside the hospital. I do want to shout out at our foundation board members. Mm-hmm. They've been with us from the good, the bad, and the, you know, not so good times, and they've stuck and supported us throughout all this. And right now they're just waiting to help, and I can feel the love. I can feel the love. Thank you.
No, that's great. Well, thank you both so much. I know, again, you're both busy, and we have the added challenge of being in multiple places, you know, and somehow extended as well. So I just, again, so proud to be a part of this group, and thank you so much for giving us your time.
Thank you, Jeff.
Take care.